Okay, good morning, uh, Your Excellencies, Dr. Humphrey Karamagi and Dr. Leah Taddasa, and all our distinguished guest speakers, invited scientists and attendees all over the world. Welcome to this global virtual scientific conference entitled Building African Acute Clinical Care Research Capacity as a Priority in Global Health. This meeting is organized by the APORC Network for Perioperative and Critical Care in collaboration with the Ethiopian Ministry of Health, following the findings of ASOS and SOS and the intensive care studies in sub-Saharan Africa. It has been observed that there are few acute clinical research studies and research capacity is limited in sub-Saharan Africa. Despite these limitations, we have managed to produce very important clinical research for Africa. As a governmental, academic, and research organization that aspires to close this gap in Africa, the Oran University is delighted with the APORC and N4PCC initiative to ensure knowledge exchange and develop an experience sharing platform. I would like to say congratulations to the members of this committee and the Oran University, from which N4PCC grow, and a few words about NPCC. When it first started, it only intended to collaborate closely with primary hospitals in Ethiopia's North and Shoa region, but after realizing the potential and needs in other parts of Ethiopia, it began to realize the challenges and collaborating with other universities to establish a national clinical research network. Later, and after realizing the challenges and similarities in conducting collaborative clinical research in Africa while working with the African Cooperative Research Group, we began teaming up with APORC to establish a Pan-African acute clinical research network in a wider perspective. So the evidence suggests that fewer clinical outcomes studies have been conducted in our African region, particularly on the COVID pandemic, where more research is needed. The only large collaborative study that examined the pandemic's impact was ACCOS, and African needs are more of the studies to understand patient outcomes in specific context and to be able to undertake a collaborative evidence-based quality improvement initiatives. In conclusion, the objective of this conference is to provide African clinicians and researchers with a forum through which they can share their research ideas, interact with and learn from the international experts, and prepare for large collaborative initiatives where possible. Thank you for supporting and joining this initiative. And at last, let me welcome our keynote speaker, Dr. Humphrey Karamagi, who is a WHO Acting African Regional Director. Thank you.
Warm introduction of health, Professor Fitsam, Bruce, and all our distinguished guests. First of all, I would want to appreciate the invitation for joining this discussion. I think this is something which is quite important in our view within WHO. We have a number of areas which we consider neglected. At present, most of the support is focused on particular areas. There is not a lot of support going into research, but specifically even if we're talking about acute care research, it's really a neglected area within the region. So really, we're quite happy to be part of this discussion, and we are looking forward to seeing how the results will take us forward. It gives me great pleasure to address you during this event. We consider it a historical event in public health within the region. The event aims to provide African research clinicians and researchers with a forum through which they can share their research ideas, interact with and learn from international experts, and prepare them for the large continental collaboration that we require to go for the health research agenda within the region. As WHO, we continue to support the member states on actions that will enhance the health outcomes for the populations in the region, in line with the mandate which the member states gave us. At WHO, our goal is to support member states to improve health outcomes through access to curative, preventive, promotive services, in line with what we are calling the triple billions target. So basically working towards ensuring that we have 1 billion more people covered under universal health coverage, health security, and under health determinants. Our strategic approach at present, the 13th General Program of Work, which I'm sure my team will manage, which I'm sure you are familiar with, gives us the thrust around which we focus the support that we are providing to member states. Consistent with this strategic approach is the need to ensure that critical care is an essential component of what we are providing in terms of support to countries. We have expanded access to critical care and improved quality of care across Africa, particularly in the context of the COVID-19 response, where we've provided a lot of support around the oxygen supply and so on. Therefore, welcome the work of this network and its potential to provide access to acute care that is quite critical for the health of our populations. Research and innovation, in our view, occupy a central position in the work that we and all the different health actors are doing. Within the context of COVID-19 and through the WHO solidarity studies, a number of different acute care therapeutics are being evaluated, even within the Africa region. As WHO, we've supported these networks to ensure that we are having the best possible evidence to guide the actions that are being carried out in the countries. For instance, we supported the studies on dexamethasone and other anti-inflammatory products during the critical care process with regard to COVID-19. In collaboration with partners, we constituted the Regional Expert Advisory Committee on Traditional Medicine for COVID-19 response, what we call the REACT group. And the aim of establishing this REACT was to provide independent scientific advice and support to countries on safety, efficacy, and quality, particularly of medical products that and therapeutics that are generated within the region, and to support countries in collaborative efforts to conduct clinical trials of medicines in compliance with international studies. And we think that this example of this REACT collaboration is a good way of showing getting local products, local expertise, and being able to apply them in a scientific manner to the benefit of our population. We have also seen this, or we have been doing this way before COVID-19 with respect, for example, to the Ebola virus disease outbreak. We did support a number of studies on monoclonal antibodies, convalescent plasma, and therapeutics in a number of the Ebola treatment units in Guinea, Liberia, and Sierra Leone and the DRC. And as a result, we have a number of good research networks around acute care. For example, we have the West African Consortium, which currently has been doing quite some good work in this area. As WHO, we look at our role as bringing experts together, enabling you to be able to know what are the important questions being asked, help facilitate the conduct of this research, but also help with the disseminating of the information that comes out from this research. And really the area around acute care is quite crucial at present. It is an area which has traditionally been ignored But I think from the experiences we are seeing, the current threats that countries are facing, there is quite a stronger emphasis on it than has been placed before. We also help to convene the experts who are able to evaluate the evidence that is emerging for the use of therapeutics and other interventions. And these recommendations, then we facilitate the their dissemination among member states and policymakers to ensure that there is an appropriate policy environment to take up what is coming from the research. We have provided consultants, we provided training to boost the capacity in acute or critical care capacity, and also help with the adoption of appropriate policies, particularly in the context of universal health coverage attainment. However, we do recognize that there's a lot more that needs to be done to really move forward the area around acute and critical care in our facilities, and especially around research in acute and critical care in our facilities. We need really to integrate research and critical care much better. And it's not just something that is done, that they are not just things that are done when they support, when they are partners, but rather they become a part of the day-to-day work that we are doing as actors in this area. We need to look at how we can build the required capacities in the countries. We know this is quite low, and many of our critical care facilities or services are really not designed for research. And these are things that we need to be thinking about changing. I want, therefore, in conclusion, to thank the organizers for this very interesting, very important invitation. This is quite important. Building African acute care research capacity is a priority for us within the region. And we have noted that the countries within the region have really not been strongly involved in the various research efforts relating, for example, to COVID-19 pandemic. We hope that within this meeting, we'll be able to discuss and see ways that we can strengthen our involvement, our researchers within the region in acute care, and making sure that we are able to get the required evidence from our own teams that is needed to guide this crucial area forward. I will stop here, and thank you once again for the invitation to WHO and for taking time to listen to us. Thank you.
I'd like to invite Dr. Leah, Ministry of Health, from Minister of Health of Ethiopia.
Great, thank you very much. Honorable Dr. Humphrey Karamagi, WHO representative, AFRO's Assistant Regional Director, respected organizers of this important conference from the African Preoperative Research Group and Deborah Burhan University and other organizers. It really gives me a great pleasure to be here with you today and address this conference on building African acute care research capacity as a priority. When we look at what it takes to build a responsive and a resilient health system that can serve to ensure equitable access and highest quality of care to its client and to its community, we all know that there are many pillars to address this huge challenge. But I would definitely say that having a culture of continuous system design and evidence-informed decision-making lies at the heart of this process. And this does require a focus to build the research capacity as a priority area in global health, which is why we are all here today. In Africa, where the provision of adequate health service is a challenge, the delivery of acute care and ICU service is really far from what's required. And the outbreak of the COVID pandemic and other emergencies have made those health service constraints even more worse. As it is evident, the shifting trend in the global burden of diseases has also shown the greater need to invest on the acute care system. And this has been similar in countries like Ethiopia and in parts of Africa. As a Minister of Health, Ethiopia's Minister of Health has been leading several efforts to strengthen services in the acute care continuum, including starting from the pre-hospital services, the facility-based services, including up to the rehabilitation, the referral system, having a strong referral system, disaster preparedness and response, as well as developing the workforce for emergency and the critical care. And this has been clearly outlined in our policies and strategies and given due emphasis as reflected in the National Emergency, Injury and Critical Care 5-year strategy we launched this past 1 year. And with these efforts within the COVID pandemic, which we have been able to increase ICU capacity nationally, where we now have around 59 ICUs in 59 hospitals, public hospitals in the country, increase the bed capacity and health workers, and planning to expand the services in different parts of the country, and also other key elements like expanding oxygen production, which we all know is very critical for this service. And one initiative worth highlighting is our Major City Emergency and Critical Care Improvement Program, MACIP, which creates linkage between university hospitals, regional health bureaus, and city mayor offices to jointly implement a customized high-impact intervention in the acute care continuum and generate local evidence to improve those cares, and currently being implemented in 8 cities. However, even though there are these encouraging progresses, the gap is still huge in addressing the demand with still the low number of ICU bed per 100,000 population, shortage of emergency and critical care drugs, supplies and equipment, and also the shortage of needed well-trained human resources. There is also a paucity of data and evidence around customized high-impact interventions to suit the demands of low and middle income countries like Ethiopia. So there is indeed a greater need to generate quality evidence and base our strategic decisions on these evidences and institute sustainable change more than ever. And this clearly requires a strong research platform, but also requires investing on strong health information system at all levels in our facilities to get the quality data that's needed to generate those evidences in a regular basis. So it's very crucial to exchange views on how to strengthen our acute care service and create the local capacity for research at this juncture. And this is, I believe, should be done in collaboration with different stakeholders and institutions like universities, research institutions, subnational and national health offices, partners, and other stakeholders. And I believe today's platform would create the opportunity to exchange experience, provide new insight and valuable input to the already initiated efforts, and also enhance strong foundation for the collaborative work across Africa and beyond. And I would like to reaffirm the interest and commitment of the Minister of Health to translate evidence into policy and work in collaboration with these groups. And we have to remember we have miles to go before realizing the overarching objective of improving the health and well-being of the population. And I would like to urge everyone to join hands in evidence generation and collaborative work in the acute care continuum for healthier, productive, and prosperous society. Finally, I would like to thank the conference of organizers for bringing this timely agenda into the table, and wish all participants to have a productive conference for today and tomorrow. It is indeed time to build Africa care research, acute care research capacity as a priority in global health. Thank you very much.
Dr. Leah, for a nice explanation of our current situation in Africa as well as in Ethiopia. Next, I would like to invite Dr. Turnesh